Welcome everybody to the Obesity Canada Hope Series. We're so glad you made it in today, and I'm delighted to say that we have representation from all over the world today. People have tuned in from Bermuda, Malaysia, Norway, Ukraine, and New York City. So thank you and welcome. We're trying to build a community. We're trying to offer knowledge and hope during this difficult time in COVID-19. So we're glad you're here. My name is Sandra Leah. I'm the Vice Chair for the Toronto chapter of Obesity Canada. I'm also a food addiction counselor here in Toronto. And today we're going to be talking about our kids' behaviors worsening during COVID-19 pandemic, a pediatrics perspective. Now, I'm not a pediatric, but I have a 9-year-old daughter, and I can say, yes, it is worsening. It is very difficult to, and it's not her fault. It's 100% my fault because I'm still trying to work full time, and I'm trying to make sure that she's doing her self-directed homeschool, and I'm trying to make sure she gets as much exercise as she used to, and also bond with her. So I'm the problem. I'm the one who's stressed out, and she, unfortunately, sometimes is the one absorbing it. I want to go through some housekeeping before we dive in. This is being recorded so that you know that. Also, be sure that you're on mute. So I can take you on a little tour of Zoom. If you roam your mouse along the bottom left-hand side, you'll see a microphone. Make sure you're on mute. You'll be able to unmute yourself if you have a question, but just know that if you're not on mute, it can be really disruptive to the meeting. If you would like to raise your hand during the question and answer period, because we will reserve some time for that, you will need to hit a button called participants. Again, that's at the bottom of your screen. You're going to hit participants. You'll find your name, and there'll be a more button. And in that more button, you can raise your hand virtually. Not to worry if you can't figure it out. You can just do it the old-fashioned way, and I'll be scanning for any hands up during the Q&A period. I suggest that you view this in speaker view. It's really the best way to see this. And again, if you roam your mouse up at the top right-hand corner, you'll see things like gallery view, and I suggest speaker view so that the speaker takes over your entire screen and you can really engage. There's also a chat box along the bottom where you can put in your questions if you would not like to ask them verbally. And turn on your video. It builds community. It's great to see faces. It's great to connect with one another visually. And again, that would be beside your mute button. So I'm going to go ahead and tell you a little bit about Obesity Canada. It's Canada's national registered charity dedicated to improving the lives of Canadians through obesity research, education, and advocacy. Through its work, Obesity Canada educates professionals, supports researchers, mentors, trainees, and students, and works with policymakers to ensure that all Canadians living with obesity receive the same level of prevention and care as Canadians living with other chronic diseases like diabetes or hypertension. I'm going to turn it over now to Dr. Arya Sharman, Professor of Medicine at the University of Alberta and Scientific Director of Obesity Canada.
Well, thanks, Sandra, and well, good morning or good afternoon or good middle of the night to all of you, wherever you might be. I'm Arya Sharma. I'm the Scientific Director of Obesity Canada, and I'm also practicing obesity doctor here in Edmonton, Canada, in Alberta. So today's topic is pretty exciting. You know, I don't deal with kids in my practice, but I do have grandkids, and I recognize that this is certainly challenging times for a lot of folks here. So why don't we start this off by introducing our panelists. I'm going to hand it over to you, Julie, who's in Montreal. Julie, welcome to the chat, and tell us a little bit about yourself and how you're holding up.
Well, I'm actually an associate professor at McGill, and I'm also running Clinic 180 in Montreal. And right now I'm dealing especially with being a parent and of course doing research and keeping the clinic, and also supporting my colleagues at McGill to on the COVID unit. So it's quite busy in Montreal right now.
Do you have any kids on the COVID unit yet?
We got a few. I just got my first COVID multi-systemic Kawasaki patient last week, and it quite impressing. But I think that in pediatrics we're used to viruses, and we were ready.
Okay. Well, thank you, Julie. And our other panelist is Rena LaFrance, who's from Edmonton, also at the University of Alberta. Rena, you want to introduce yourself?
Sure. Hi, everybody. I'm so happy to be here. I'm Rena LaFrance. I am a pediatric psychiatrist here in Edmonton at the Stollery Children's Hospital, and I also am the clinical director for the Pediatric Center for Weight and Health at the Misericordia Hospital. I want to say hi to my team who's been supporting me running virtual clinics from home. And where I'm at home, I have 2 kiddos. I'm single momming it and a dog. And it's been busy. It's been quite an adjustment for me, and an adjustment taking care of patients. Their mental health needs have changed. Their parents' mental health needs have changed throughout this. And then trying to maintain healthy lifestyle for myself here, which some days is harder than others. And, you know, some days I want to eat comfort foods like everybody else and wonder what's going to happen next. But we're managing, and we're doing pretty well. So.
Okay. Excellent. So Julie, perhaps I can start with you. You know, last month I was reading in Obesity this article by Andrew Rundle from Columbia. You know, and reading that article, you know, where he talked about you know some of the impacts that the COVID epidemic is having on kids. You know, he paints a rather bleak picture. And maybe you can tell us a little bit about that paper and what your thoughts on that are.
Yeah, I think, thank you. I think they started this paper with very useful and realistic situation that all parents, but also caregivers in pediatrics were facing during the pandemic. They brought up that, you know, it creates food environment and physical activity challenges, just as Rena mentioned with her own family. And that really makes also some difference between urban and rural cities. So that was quite interesting because the school closures, social distancing, parental, socio-economical difficulties have put a lot of pressure on them, and especially on their kids. So I think that from there, we have to worry and to share about what's the future of these kids and how we can support them.
So Rena, you know, we've seen previous data that children and adolescents, you know, they tend to actually have worse habits, and in fact, they sometimes experience weight gain during the holidays when they're off school, which is kind of paradoxical because you would think when, you know, they're off school, they're out there playing, they've got lots of time on their hands. But it seems that, you know, having holidays does not appear to be good for the health of kids. And now we've got this extended stay-at-home holiday. So what's your take on this, Rena? What are you seeing?
So definitely during summer holidays, we see kids can put on weight or gain weight. And we're in this weird situation where it's summer holidays during a pandemic, right? So we're not only, you know, off, but we're traumatized too. It was too much too soon, and all of us had to adjust in a very short period of time, including our kiddos who all of a sudden are staying at home. They're away from their friends. They're away from, you know, their support system. Their whole little lives changed, right? And so what we see in those situations, so in a regular summer holiday, we would see less structure, we would see lots more access to the fridge, we would see more sedentary time playing games potentially, and it's not like the old days where, you know, your mom put you outside for, you know, 8 hours and let you back in at the end of the day. Lots of kids are staying inside at home, watching TV, Nintendo, all the stuff, right? So the extracurricular activities are maybe a little bit less, like kids do play soccer and things in the summer, but it's not necessarily as structured as it was. And then you can, you know, play your PlayStation and snack. So there's lots of reasons why weight gain is more in the summertime. And now, like I said, we're like on anxious summer holidays, basically, with this pandemic.
Now, one of the big problems that we have is not just that we stay at home, but a lot of people have lost their income or are working fewer hours than before. So there's a huge economic impact of this. which raises the issue about affordability of food. So, I mean, food at the best of times, food insecurity is an issue. But now, and we know that a lot of kids just, depend on school breakfast, school lunches, and all of that has gone away. So Julie, what's your take on that in terms of food insecurity? Can you perhaps explain, what we mean by the term food insecurity and why this is so important?
Well, food insecurity is, everywhere. I mean, in every cities, big cities, small cities. I mean, when you have lower incomes, there are some food that are not affordable, and unfortunately, during the pandemic, that was very accentuated. In Montreal, as an example, we got many calls from parents where to get this and that, and I mean. We all experience going grocery shopping since the beginning, and so many shelves are empty, and those who are on sale or maybe more accessible are not always the best ones. There's a lot of grab and go meals, especially for single parent working from home, and also the pandemic came at the worst moment of the year here in Canada, since farmer markets are not available and usually give some help to reduce cost and increase accessibility. So it was quite hard, and it is still quite hard. Harvesting is not done yet, so we need to pay attention to that as Canadians, but also elsewhere in the world, that food has to be more accessible and with better prices.
So we see it as an issue, but what are possible solutions? What would your advice be to parents who have, say, small children at home and are thinking about, what are the foods that they can afford? What can they afford to feed their children that is still a healthy diet?
Well, the first thing is to schedule a little bit being at home with them. We've seen many of them have no schedule, and it takes time to cook. It takes time to prepare meals. And one thing that we ask them, some bigger ones can help with the grocery list. They can look at the specials in different groceries. They can also go with the appropriate social distancing and a mask grocery shopping for the parents. They can also prepare healthy snacks, and they can of course supervise the small ones to improve cooking, but of course it's difficult, and they have to prepare more food, and they have, what is amazing is that they have less time than usual by being at home. So
yeah. And so Julie, you mentioned social distancing, and Rena, I want to bring you in on this. Social distancing can be extremely stressful. You've talked about children being at home and not having contact with their friends, and they might be contacting their friends through video games or through social media. At the end of the day, there's a lot of screen time, and how is that adversely affecting the kids? And again, what do you suggest that parents could do about it? So why is this a problem, and what can we do about it?
So I think we're in this transition phase now in Canada here, where we're starting to loosen up restrictions a little bit, and I think that is a huge benefit for us right now. It's nicer weather outside. So, our chief medical officer of health has recommended social distance, but do it outside, in an open container, be 6 feet apart, but be around your friends. I think as parents, we can take these guys for walks now. The playgrounds aren't open here yet in Alberta, but because of infection control reasons, but you can go for a walk, you can kick a ball around with a friend even, and maintains that more than 6 feet distance from them. Bike rides. I agree 100% with Julie. We need structure to the day. These kiddos are going to bed at whatever time and waking up at whatever time. We really need to have structure for what their schedule looks like, as though they were attending school, how much homework, and, we're schooling during a crisis. We need to make sure that we understand that this is not homeschooling in the sense that we chose this, we didn't choose this. And so we really need to make sure that they're doing work, but that it's a subscribed amount of time during the day, and that quality time is being emphasized. So if you want to cook with your kids, make conscious, healthy choices. The farmers markets will start to open up soon, which is a great thing. Pick the whole foods, pick the less processed foods. We had to stockpile processed foods because we didn't know what this was going to look like, so they're in the house and stuff, but now we can, bring in more fruits and vegetables and healthier choices. I think stress relief is a really important thing. If you can do yoga with your kids, if you can do, encourage meditation, looking at sort of that quality time, that activity time together, and then giving them downtimes. And they can still Zoom with their friends like we're doing right now. They can have, virtual sort of meetups and things. And you can have barbecues where you have a certain number of people. Here in Alberta, it's under 15 and you're distanced from them. So be social. So it's physical distance, but it's social connection. That's what we should be emphasizing.
And Julie, what advice would you have for, for parents who are finding that, now that the kids are at home, there's a lot more screen time. And perhaps you can share with us some of the evidence that how screen time is related to weight gain and just sedentariness, and interestingly how that actually affects eating behaviors. I find that very interesting.
Yeah. In fact, we know that for a while that, being in front of a screen will increase overweight and obesity. And it will increase, in fact, the will of having snacks. And I think that 2 years ago, Heart and Stroke Foundation have shown very interesting data in kids that, screen are exposing kids to unhealthy choices many times throughout the day. So I think that the advice is it also reduces the quality of sleep, which is also associated with overweight. So it is important to maybe have a deal with your kids and saying that throughout the schedule, throughout the day, there will be some time permitted for screen time, but beside that, they can go outside, they can help with housekeeping and of course you give them responsibilities with the small ones, but also in the house. So you need to keep them busy. If you don't keep them busy, they're going to go to the TV, they're going to go in front of a screen with other kids doing the same thing. So it's important that we schedule, and of course by saying during Sundays or Saturdays you can have more time, or there's always a way to make this discussion with teen especially more easier.
So Rena, I want to turn to another aspect, and you're the psychiatrist. So obviously mental health is an issue here. And the question I would have for you is how does the social distancing and the fact that we're living here, I mean, the kids, they sense that their parents are anxious and that things are not normal. I know that my daughters are having conversations with their 4-year-olds and 5-year-olds about the COVID virus, and the kids are, affected by that. And so what is your sense of what the mental health impacts on kids might be from this whole pandemic, staying at home, social distancing, all the issues that kids are facing?
It's been really interesting, actually. Because I'm working from home and clinical space is a little bit more available, I've been able to support some of my kids that are anxious about this, and so see them a little bit regularly. Especially the teenage girls have actually asked for a little bit more support. Their mothers, a lot of them, are asking for a little bit more support during this time. I think we all are anxious. I mean, this is a large-scale biological threat. We are all traumatized. My kids that were having a lot of trouble with school, so they were very anxious around school and school focus and getting bullied, things have eased up a little bit on that front. So in some ways, kids are less anxious depending on what it is that was making them anxious before. My guys that are extremely worried about a pandemic and, some of them with OCD and those kinds of things, this is a nightmare. And so I spent a lot of time, managing and dealing with that. We've seen the guys that have attention deficit, parents now having to school in a crisis are really seeing those signs and symptoms. So there's been lots of discussion around that. Depression has been a little bit worse for some of the kids because they are isolated. They're very social media based, generation, these younger guys, and instant gratification. And now they don't really know how to entertain themselves during the day. And so that's made them a little bit more stressed. I've seen some change in eating, emotional eating, eating through boredom. Not so much of a change with binge or loss of control. That stayed about the same with my guys, but in general, people have easier access to the fridge and they're on their, handhelds or their, Xbox or whatever, and they're snacking while they're doing that. So certainly there's been eating for comfort. And overall, everybody's just, there's a lot of uncertainty. When there's a lot of uncertainty and you don't know what's going to happen next, anxiety in general has gone up. But I think that humans are so resilient that we're starting to transition. We're coping, we're problem solving, we're finding strategies, and these kids are no different. And I'm lucky and grateful that I can provide them support, the ones that are already seeing me, and I've been taking new patients too, but provide them support, through this difficult time, even if it's just a few words of comfort or encouragement. And I know, again, I have a whole team, a multidisciplinary team, and they're doing the same thing. So we've been really lucky to continue to be able to provide care throughout this.
So Julie, a question for you that maybe it's a little bit out of thank you. What do you think is a role for an organization like Obesity Canada in times like this in terms of providing information, providing support? What do you think Obesity Canada could be doing or should be doing? And maybe what are the things that Obesity Canada has been doing in your experience that you think would support parents and support people during these times?
Well, I think that what we have seen the most and the requests from the families are really converging to support with cooking skills. I mean, they really need, if you're trying to change your diet, if you're trying to move a little bit more, you need support, and you need some general recommendations. So I think that where Obesity Canada can go in the next months and years is to support with cooking ideas or books, and maybe some more general advices how to read a label, how to support a family throughout the first 1-2 months of changes, because it always comes back in clinic. I mean, the nutritionist was asked many times throughout the 2 last months, give me recipes for breakfast. I have no idea. Give me ideas for lunch or snacking. And I think that we need more practical advice to support parents, because I mean, even if they go back to work, even if the kids are going back to school, the questions will come back. How do I prepare my lunch? How do I grocery shop during the weekends? And they're going to be still very busy to start up everything back and put everything back on track. So we're going to have to be more sensitive to what I call the emotional parenting skills.
Yeah. So thank you for that comment. And as you know, of course, Obesity Canada is currently also working on the pediatric obesity management guidelines, which we hope will come out in however long it takes. So there's a lot of work going on at Obesity Canada right now in the pediatric field. I think it's now perhaps time to hear a bit from some of the listeners. So Sandra, I'll give this back to you. Do we have any questions from the viewers?
Yeah. Does anyone have a question, a comment, anything that they would like to share, perhaps something you're experiencing in your own practice that you're struggling with? The floor is open. So you can either raise your hand electronically by hitting the participant button at the bottom of your navigation bar, and then finding your name and hitting the more button to raise your hand, or you can put it in the chat box, and that is also at the bottom of your navigation bar, or you can do it the old-fashioned way. I'll be looking for you. I'd like to open the floor with a question for Rena. So I have a 9-year-old daughter, and we do not have cable. So she's not exposed to any of the news that's happening, at least when she's here. She does spend 50% of her time at her dad's, so I'm not sure about her dad's. And I'm really concerned about the fear and anxiety that she may be absorbing during this time. And I do try to talk to her, and she says, no, I'm fine. But I can tell by some of the behaviors that are a little different than what we were experiencing, pre-COVID. And I don't know how to get her to talk about it or how to help her navigate some of those fears and anxieties.
I think that's a great question, and I think all of us have been trying to figure out how to talk to our kids about what's going on. So I have a little guy who's 5, and I have a 10-year-old. So I have similar age to you, and I've just made it known that they can come to me and ask questions if they're worrying about stuff. I talk about it openly. They know what's going on. They know why we're doing what we're doing. I think openness and communication and just making yourself available to that. If you notice something, saying, hey, I feel a little bit more anxious right now about this, or did you hear something that you're worried about? Is there anything you want to talk about? Just making the opportunity available for her to talk to you when she's able to or ready to. Lots of kiddos, they don't want to talk. They're just like, I don't want to deal with this. This is I'm fine, mom. And that's okay. We don't have to make them, but certainly we want to be, as parents, open and available so that if it comes up or if you notice something, you can point it out. And then having those discussions with her, just saying, hey, this is where we're at right now and things are looking better. And, depending on what's going on, we're doing really well and this is working, and really embedding positive, encouraging messages in there too, that collectively, here I speak for Canada here, and I can speak a little bit more for Alberta, but we've really pulled together as a community. We've really tried hard to take care of that greater good, and that's a beautiful message for our kids to be learning right now, of how much we actually care about each other, that we stayed home for about 2 months and didn't go out and didn't do anything because we really wanted to make sure all of us have the best chance. And I know when I see what's happening in Montreal right now, and my heart is with those guys, and I've got friends with infectious disease there, and they're working hard to get this thing under control, and there's lots of love, and I think that is a beautiful thing that we're seeing right now.
Yeah, thank you. I think I'm taking away is maybe making some scheduled maybe time for it, like, hey, maybe at breakfast, hey, so that I'm asking the questions, because like you get it, like you just can't force it even though you can feel it.
Totally. And make it not just about COVID, make it about, hey, what do you want to talk about? What's going good? What are we grateful for? I do that every day with my kids. Everybody has to say one thing that they're grateful for, and what we want from the day. And they're little, but they can still say, I'm happy for my mommy and I want to play.
I love that.
So Rena, I have a question for you, and maybe this is also for Julie. So at what point in this, when you're struggling and you're seeing that your kids might have a problem, do you actually reach out for professional help in all of this? And where do you find that help in times like this, where we know that, a lot of clinics are closed, your family doctor might only be doing virtual visits? When do what are the signs that you need to look for when you say, we need to reach out? And this is perhaps getting a bit more serious. And let's include other topics here. This might not just be the pandemic. I mean, we're also hearing a lot about, domestic violence, domestic tension that goes on between parents. So at what point do you reach out for professional help outside your home? And where do you find that help in times like this? So Rena and maybe Julie you can give us some advice there.
Maybe I'll start and then we can pass to you, Julie. So for me, the name of the game has always been quality, like functioning, right? So if you see your little one not engaging with you, they're not sleeping, they seem to be staying up late at night, they're coming to you and they're anxious, there's some separation anxiety, they don't seem as happy, their mood isn't as good, they're not eating as well. All of these things show that you're not functioning as well. And then I would reach out to my family physician. So I belong to a women's physicians group on Facebook, and I made myself available to those women, who are in family medicine and pediatrics, to be able to access me a little bit easier, because again, I'm not in a clinic fighting for clinical space right now. I can see patients a little bit easier. So if they're concerned, they can run things by me. I think we have, as a network of physicians, need to support each other as well to be able to make time to be able to help during this. And, you know, emergency is still an option. Go to emergency if you need to. Call the urgent services if you need to, because we are still taking care of all of the other disease processes beyond COVID, and people need to go in when they need to go in. I think if there's a dangerousness, if you're worried about, you know, suicide or, you know, suicidal type gestures, all of that stuff, and you're concerned, contact your family physician, contact your pediatrician. I work on our team with the Pediatrics. We work together. If there's concerns between us, we will share that. And I think knowing that you can continue to reach out into the healthcare system, and you can access care, that we're still here. We haven't gone anywhere. We might be at home, but we're still available to you.
Exactly. And I agree with Farina, and I would just complete with the fact that, you know, irritability in kids is a good sign where you do not recognize your child as previously. And the other thing that I found very important is to reassure parents. Rina, you talked a little bit about it, but parents don't know that we have cold corridors of cares, and that they can be safe consulting at the hospital. And the other thing is that, you know, in Quebec, a lot of psychological support was postponed at the beginning, but I mean, they had to change the way of supporting kids, and now they can support through videos. So I agree that we are there no matter what, and that parents can always find some medical support or psychological support if they need it.
So what I'm hearing is don't hesitate to reach out, and that resources are available and can be accessed.
Definitely.
Sandra, do we have any questions?
Who would like to go next? Who has a question? Oh, okay. Natalie has her hand up. I've unmuted you. Go ahead, Natalie.
Hi, thanks a lot for that great.
Oh, Natalie, could I ask you to speak a little bit closer to your microphone? We're having a little trouble hearing you.
Yeah, thanks. Thanks, Sandra. Sometimes I feel like we preach to the choir, because like sometimes our recommendation, it's for people who have already access to those resources. Do we sometimes even created that inequality and resource? Because like people, we don't have access to internet, or have only one computer, or only have like they're living at 2 adults with 3 kids on a room of 5 on the 3rd floor without just like a little balcony. I mean, sometimes I feel like we preaches to the one who could have the resource. And we know like obesity could trigger with the social inequality, all the education and the other information. I don't know. I think like having access to a psychologist, a nutritionist, I know like I salute Clinique 180 because like Julie Saint-Pierre give like an amazing tool to people, and she really take care about that. So Julie, could you talk about more of that?
Sure. Thank you, Natalie. I think what is the most difficult things about inequalities is that it affects minorities, and in Montreal this is so true. I don't know about the other big cities across the nation, but in Montreal it breaks my heart because of course they do not have the same access, and many of them don't have insurance to cover the psychological cares, and in Quebec there's a problem with this, because there's more services on the private side than on the public side. So we do have inequalities, and this is, I think this is more true in big cities than in rural space, where people are more working with the enlarged family and supporting a little bit more each other. Here all the time I see a lot of parents struggling to support their family financially, and have 2-3 jobs, and their kid suffers from obesity, but they cannot give more time to this kid. They cannot do more. So we are preaching sometime in the desert, because we have recommendations. We want to help them, but they're facing a very difficult reality every day.
Thanks.
Thank you. We have time for one more question. One more question. Rachel, did you say you had a question? I'll unmute you.
Great. Yeah, I do. I also did see a couple come up in the chat box that looked pretty interesting too.
I missed that. Thank you.
Yeah, but I'll quickly ask my question. It's kind of one of my favorites. So if you had a magic wand, Julie and Rena, and by the way, you guys have been fantastic and very helpful. But if you had a magic wand and you could cast a global behavior spell on all of the kids right now, what would it be so that they come through COVID and they're better physically and mentally?
Okay, I'll go first. If I had a magic wand, I would ask them to be conscious and intentional with how they spend their time. I would ask them to focus on quality time, fun, enjoyment, and play. And I would ask that they remember that this is going to end, and there is going to come a point where we will be past this, and this will be over, and we'll be looking back on it. So there is always hope around, whatever we're in the middle of this storm, there's still hope. And really focusing on getting out and playing and having fun and making time with their families to make meals and to be very conscious. And I would ask that of the parents as well. We have these kids that come to us as our patients, but it's the whole family that we're addressing. And so really, thinking about the fact that we've never had this much time with our kids at home in the same space. They're home with us now all the time. We have opportunity. And if we focus on the opportunity to do things, to move, to have fun, to play, to eat well, we can get through this. Like I said, with that bigger picture of taking care of each other, but also that benefits coming out of this. And this is all changing us. This is changing our characters. This is changing who we are. And the thing that is beautiful about watching this and being able to support a lot of my kiddos through this is that they're amazing, resilient creatures. And so are we. And so I think that's what I would focus on.
And to complete what you said, Rena, let's make this a dream on top of everything. If we could have our Prime Minister give extra money to Obesity Canada, so we put in place, so we can put in place some platforms for teenagers across the nation to support each other, and that is important because we are adults, and no matter what we do or what the recommendations are, kids are great supporting each other. So I think that if we could have extra money from Canada and that Obesity Canada could support that and deploy that across the nation, it would be so helpful for kids to support each other.
I want to add to that as well, if I can. I don't know. I just wanted to say too, obesity is a chronic disease, and we're seeing that it's a massive risk factor for severity of outcome. We're seeing that across the world right now. North America is going to be no stranger to that. And now we're looking back and saying, oh darn, like this risk factor is making outcomes worse for people, and we're in the middle of this pandemic. We need to be more proactive with treating this chronic disease so that we don't have to come and look back and say we should have done more. We should be doing more now because these outcomes are worse. ICU and hospitalizations and mortality are worse because of this thing. And why not look at it as something that we should be actively, focusing on and treating as a priority now?
Perfect.
Thank you. We have 2 more questions in the chat box and then we'll wrap up. So this one comes from Kathleen. Is talking about obesity during the COVID-19 pandemic putting more pressure on the shoulders of parents who have already so much on their plate? How can we talk about it without increasing their guilt?
Maybe I can start with this one because, when the pandemic started, I felt a little bit, uncomfortable to talk about obesity. And I was, very anxious, like many other pediatricians, to see how the wave would hit Canada. And surprisingly, people were reaching out. They wanted to talk about obesity, and a lot of them were worried before we were even into the pandemic. So I think it depends on different personalities, but overall, I mean, we've been so busy in teleconsultation and parents keeping us busy to talk about it throughout the pandemic. I think that, we of course we can focus on healthy habits instead of talking about obesity for some anxious parents, but I don't think it puts additional pressure. I think that, like Rena said, we have just seen that it's a major risk factor in that, and that people need to treat this disease, and we should not feel shy to talk about the disease, and we should like we talk about all the other disease. So I think we have to look back and see that the needs were there and parents were concerned.
Thank you. We have one final question in our last few moments, and this one is, I'm going to give it to Anna. Schools are about to resume on a part-time basis with social distancing and additional hygiene schedules. What recommendations would you give for the kids who are anxious about the new school landscape?
I'm just going to quickly go back to the last point.
Sure.
I just want parents to give themselves a little bit of grace here. We are all doing the absolute best that we can. Baby steps. Take it slow. Some days are going to be better than others. Do not be guilty. Do not feel shame. All of us are struggling. I am struggling. We are all struggling. Some days, like I said, are better than others. So please, don't think you have to pandemic perfectly. There is no perfect pandemicing. Okay, that is like a huge thing I think I want people to understand. And so to the point of schools reopening and we're feeling anxious, was that Sandra?
Yes, the schools are opening. How do we make our kids feel comfortable about going back if they're scared to?
I mean, to me, we aren't opening here in at least September here in Alberta. And I think that it's probably a wise thing. We don't know what waves are coming next. Pandemics come in waves and the virus hasn't gone anywhere. And so I understand their anxiety. I would be anxious too. Our school teachers and aides and all of the people that have to now be responsible for classrooms of children, keeping distance. And I have a 5-year-old. I don't know that he has any concept of how to do that. So I think it's justifiable. And I think there needs to be some personal choice here too about whether or not you're comfortable. These are our children and we have to make decisions that are best for them. And I'm hoping that, in jurisdictions that are opening up schools, that they're listening to the concerns of parents, because I feel they're justifiable. As Julie pointed out, we are seeing this multi-systemic Kawasaki-like disease process. We don't know, we were under some amount of, I think, happy thought that this wasn't affecting kids as it was adults, but I don't think we can say that anymore. And so I think we need to be very smart about how we reopen things. And we can't assume that children are safe, and we can't assume also that they're not going to transmit it to their grandparents, or so let's be cautious here and do this very carefully. And I think that's consulting with pediatrics. I think that's consulting with people who are in education to be able to make those decisions. And I would put that to Julie as well, her thoughts working within PEDS.
Thank you.
So Rena, Julie, I'd like to thank you so much for taking the time for doing this. I know you have very busy schedules. The one thing that came to mind with the previous question, where what is it that parents can do when they're concerned about their kids' weight? I think one thing we've all learned and we've often propagated is try to avoid fat talk. If parents bring fat talk into it, so making jokes about weight gain, talking about weight gain, when the parents are concerned about themselves gaining weight, all of this translates to the kids and can promote negative body image and other issues. So that of course is something we take very seriously here at Obesity Canada. So once again, thanks to both of you for taking the time. Thanks to everybody here for taking the time to join us. This is a series, so there'll be other talks announced, and hopefully you'll be joining us again from around the world. Sandra, if you take us out of this.
Yes, of course. Yeah, we have one coming up next week. But before I tell you about that, I just want to build on what Julie had to say. Wouldn't it be wonderful if our government invested in obesity research and started to help at the level of childhood obesity? And until that's the case, we really do rely on donations. So I'm just going to put up a slide here to show you how you can donate to Obesity Canada. We are just wrapping up a hero's effort in getting out the clinical practical guidelines that will be coming out shortly. I'm not sure on the date, Aria. When do those come out?
Well, we hope they'll be out in the next few weeks.
In the next few weeks, and this will allow for treatment, will allow for patients to feel empowered to go to their doctors and ask for evidence-based treatment options. So here's how you can donate, and tune in again on May 28th at 1 o'clock, where we'll have Dr. Sandy Van and myself talking about emotional eating during quarantine. So I look forward to seeing everyone next week. Goodbye, everyone. Thanks again for tuning in. And please, if you can, donate to this amazing cause.
Thank you.
I'm just going to leave the screen up for anybody who needs to jot down any of this information. You can also find the link in the chat box.